Life is one of the most precious gifts we are given. Why, then, would anybody choose to give it up? However, some people who suffer from terminal illnesses that cause them great pain and suffering choose to end their lives, and some who become comatose or in a vegetative state choose to be taken off life support. However, sometimes these procedures are done against the patient's will, or if the patient has not expressly dictated that they would like to be euthanized. Involuntary euthanasia is wrong, and it infringes on our constitutional right to life. Today, I will talk about several options not only to prevent involuntary euthanasia, but alternatives to it as well, such as palliative care, living wills, and hospital funding. Living wills are made by when you decide to write out what you would like to happen should you be able to not be able to communicate your wishes. By making a living will, you can dictate whether or not you would like to be taken off life support should you become comatose. However, if individuals don't have a living will, it is up to their families to decide, and the patient may be taken off life support against their will. Making a living will can prevent involuntary euthanasia and should be practiced by more people. Many times in hospitals, passive euthanasia is carried out to free up beds for more patients as well as facilitate organ donation from those who are comatose or in a vegetative state. However, oftentimes these patients may not have living wills or family members to make the decisions for them, and therefore it is up to the will of the doctors. In order to stop this from happening, we should donate more money to hospitals so they can expand their facilities and have more beds. This way, less involuntary euthanasia will occur, but new patients will be able to enter the hospital. Palliative care is a kind of medicine that allows patients to die gracefully without a lethal injection. Through medication and meditation, they ease the mind of the patient going through terminal illness and provide an alternative to euthanasia. Palliative care should be expanded and used in more cases in order to end involuntary euthanasia. Today I've talked about alternatives and ways to prevent euthanasia. However, you can do these yourself by talking to family members and making a living will. Involuntary euthanasia infringes on our constitutional right to life and should never be used in any case.